Okay, so today we're going to do our Tru Diagnostic test. It's an epigenetic test similar to index by Elysium, but it's a little bit different. Instead of saliva, it uses blood. So if you get a little squeamish around blood, you're going to see a few drops, but you'll see it coming. When you register your kit, make sure to not use any dashes in your password, or you'll have to get into the whole thing and end up calling them. But they're very nice. They call back within like 30 seconds. So when you open the box, you'll see this information to register your kit. You're going to put these numbers in directly, but you'll have your own numbers. And the other thing that you'll see here is the blood sample thing. So be careful with this. You don't want to touch too many parts of it because it's important that it only has your blood on it. So you're gonna remove that. Just touch the edges of it. You do not want to touch this inside part. So be careful to set that aside here. Then we're gonna take that out. There's a few things in here. The manual on getting your blood kit. There's an envelope to mail it back to them. A little card that explains how you're supposed to do the blood sample. So this is correct, this is incorrect, this is also incorrect. You do not drop your blood on that. That's just showing you how to do it. And then most of the stuff is right inside here. So you'll take this out, you'll open it up, and you're gonna empty the things in here. Okay, so the instructions are gonna be in here. It'll tell you all the things that it comes with. It's going to tell you to register your kit. Wash and prep your hands. So the first thing we're going to do is we're going to wash our hands with soap. Okay. Then we're going to use our alcohol swab that they give us. When it's dry, we're going to take this little alcohol swab out. I'm going to use this finger because I've had luck with it before. I'm just going to wipe that down. And they recommend using the side of your finger. There's less nerves here on the side, so even though the little finger prick is basically nothing, you won't feel it. It doesn't hurt. You'll feel it a little bit less if you use the side of your finger. So then we're going to let that dry. They also recommend either using warm water for your hands. You'll get some more blood out that way. And they also, you can do some jumping jacks to get the blood flow. Spin your arm around like a crazy person. So we're going to get our lancet here. We're going to fill this whole circle with blood. It's okay if it goes a little bit outside the edges, but you also want to see that the blood goes through all the way. So they need a good healthy amount of blood. You're going to remove this lancet here, and then you're just going to push it against your finger, and you'll hear it snap, and you'll start getting some blood flowing, hopefully. And do not touch your finger to it. You've just got to sit here and bleed for your longevity. Don't worry, be patient, you're going to live forever. You have time. There we go. You can milk your finger like a little udder. Don't worry, there's plenty of blood in you. So far it's taken 3 drops and it's almost full, so even though that circle looks big, not too bad. Then it starts spreading. This is a form of coloring in the lines. So do not touch that part of the card. Come on, little buddy. You got a lot of blood on this thing. It's also important not to let it dry and then add more blood. You gotta just get it all out and just go. I think one more drop and we'll be good. There we go. So you can give yourself another little wipe. They've given you a gauze pad, and they've also given you a bandage. So you can see here, Do not touch the blood card with your finger, as this will restrict blood flow. Do not let additional blood to the circle once completed or drying. Layering of blood will invalidate it. Make sure it's fully saturated. It will take more than one drop. You can see on the other side that it's more than soaked through. And you're going to want to let this dry. You want to dry completely. Place it in a safe location away from moisture and direct sunlight for at least 3 hours. Once the blood spot card is dry, tuck the card's cover. Once it's dry, you're going to tuck the cover, and then you're going to put it in that envelope, and you're going to mail it off. I usually stop bleeding quickly. I already stopped bleeding. All right, so this card is going to go inside here. It absolutely must go inside here because your registration number is on this bag. So once this dries for 3 hours, you're going to close it up. You're going to slide that top underneath there, and then you're going to slide it into this bag, and you're going to put the bag inside this envelope, and it's already got a stamp and an address, so you'll be good to go after that. Seal in the bag. Do not fold the blood spot card. Do not mail the blood spot card without the biohazard bag. Ship in the sample. And they say it takes about 4 to 6 weeks to get your results. So let's take a little look here at some of the stuff going on. You want to dispose of this stuff. They've got a pretty cool set of tests that they're doing. It's more than just epigenomics. They're looking at different blood markers, for example. They're going to give you a result that looks something like this. It's going to tell you your OMIC age, your biological age versus your calendar age, and it'll see whether or not your biological age is lower than your calendar age, or it's higher, or it's the same. But beyond that, they're actually going to give you more stuff. They're going to give you risk of death if it didn't get any more, intimidating than that. Risk of cancer, stroke. They're also going to talk about heart disease, type 2 diabetes, COPD, depression, and then they get into some more details, clinical factors, proteins, methylation around proteins, different metabolites, and they're going to tell you whether or not your methylation risk is associated with a lower OMIC age or a higher OMIC age. Then they also look at some of your just clinical results of some of the information they can pull from the blood sample. So there you have it. This is the Tru Diagnostic test. Don't forget to not touch the card with your hand. Make sure that it's soaked all the way through. Let it dry for 3 hours. Then you're going to fold this over, slide it in here, put it in there. In about 4 to 6 weeks, you're going to know your biological age and a whole bunch of cool risk factors. Good luck cheating death.